So today we are in Torino, and I have the pleasure to be together with Professor Adriano Chiò, responsible for the ALS Centre in Molinette Hospital in Torino, which is one of the clinical pilot sites involved in the BRAINTEASER clinical activities and piloting of the solutions developed. Professor, first of all, we are here in Biobank, so maybe we can take the occasion to say something about this place, and then we can proceed with other questions.
This is the this is the biobank of our neuroscience department. So all departments of the departments have their samples here. It's a biobank that has been just opened only a few months ago, and the name is Professor Davide Schiffer, who was my mentor, and so he was a neuropathologist. We have a lot of samples, and we do research in different areas, not only neurology, also psychiatry, neurosurgery, and other areas of neuroscience.
Very good. So the clinical site of Torino has been full partner since the very beginning of the project. The project is around 4 years running right now. This means that the clinical protocol and the solutions developed within BRAINTEASER have been tested for a long period already. Which are the clinical targets, let's say, or goals that have been achieved so far?
So, first of all, the project was focused on two disorders, neurological disorders. One is multiple sclerosis, which is an autoimmune disorder, and the other is amyotrophic lateral sclerosis, which is a neurodegenerative disorder. The idea was to construct and make a training with different apps in order to have the possibility to follow the patients at distance, and to have give the clinician information about the health of the patients, including, which is a particular part, the pollution, because we had already some indication that pollution can modify the course of the disease. It is particularly true for MS. It's not clear for ALS, but that's one of the points we have obtained.
It's not clear yet for ALS, so we need a little bit more research that can be built upon what we have achieved so far. Which is the perception of this clinical study, both within the healthcare professionals that have been involved so far, but more importantly, the patients?
Well, for health professionals, our feeling is very positive, because we think we have another possibility to monitor the patients. And the idea to monitor the patient in their day-by-day life, not only in the clinic, but is something really important for disorders that have a huge impact on the quality of life and the movement and so on of the patients. And the patients are, in general, very happy, because they feel to be more cared for, and they know that the information are used by the clinicians in order to improve the care in general. And then there is also an important impact on the caregivers, because they feel more safe during all the days, because they feel, oh, there is something that can help us to monitor and to help the patients when something negative happens, and that's possible. That's something that really happens in this type of disorders.
So all in all, you have a very positive, let's say, assessment of what has been done so far. The project is coming to an end. What do you think is going to be the future of the BRAINTEASER intervention after the end of the project, and so the funding period? Do you think to keep it on use it or not?
We already think to keep it on use on our patients, and really, but it's not a private project. What we want to have is that we are going to have a diffusion of what we have found. We are going to have a final presentation of our results to a large public, including the ALS and MS Association, obviously, the stakeholders in general, but something that should be really proposed to the centers, not only from these two disorders. They can be used as paradigm for other degenerative or progressive disorders in the area of neurology. And there are a lot of them, for example, Alzheimer's disease, Huntington disease, Parkinson's disease, and so on.
Okay, so you not only think about keeping on using it, but also to scale up and to promote the scale up of these results for in different settings, let's say, and also to address different neurological diseases. So this is a very, this is a message full of hope, let's say, and it's really rewarding for all the work that has been done so far. Thank you so much, Professor.
Thank you.
Thank you.